country. However, as I'm based in Hong Kong, the current situation does not allow it. STADA is very proud of its latest brand, Oilatum. Its heritage of expertise in skin health will undoubtedly help bolster STADA's presence in the consumer skincare category. This is crucial because it helps further STADA's vision to be a trusted partner that provides high-quality, holistic care for people's health. For more than 120 years, STADA has been helping more and more people live dignified and able lives as we strive to make high-quality products affordable. We work closely with experts in medicine, science, sport, and lifestyle to find ways to help improve everyday lives. STADA is one of the fastest growing consumer health companies and can now offer consumer health products in all relevant health categories. With Oilatum, we believe that high quality skincare for toddlers is within reach. We know this will be welcome news to Filipino moms, and, as the brand promise says, another amazing way to show their love for their child. Thank you very much. I wish you an informative and enjoyable day, and hope to be in the Philippines again soon to share in the success of our team. Thank you.
In my lecture, you want to ask something, it's okay for you to interrupt me. Okay? So I've specifically entitled my lecture, can you switch now? There. So I specifically entitled it Parents in Tune because knowing is caring, and we know caring is equivalent to loving. So I have several disclosures. Of course, I'm doing this lecture for STADA Pharmaceutical, but other than this, I have no conflicts of interest. The photos I'm using are actually paid photos from Shutterstock. The others are from derm nets in New Zealand, which are all free. So I am a pediatric dermatologist. I'm a dermatologist who underwent pediatric training abroad. I am affiliated with both private and government hospitals. My advocacies are the following. I want a safe use of oral and topical dermatologic preparation, breastfeeding and appropriate infant feeding, and psoriasis for the adult and the pediatric population. So for today, this is just what I want you to take home from my lecture. I just want to reiterate again and to explain to you what are the different age groups in the pediatric population. And in each of these age groups, there are different dermatological or skin conditions that parents are often dealing with. At the end, I would like to summarize all the problems, try to give solutions to it. I would like to also reiterate the importance of cleaning or bathing our baby, and what are the important components of a good skin cleanser. So these are the age groupings. This is from the US FDA journal. So for the interest of time, I'm just going to discuss the young child, which is around 2 to 6 years old, the child, which is 6 to 12 years old, and of course the adolescents, 12 to 18 years old. So this is a young child. We know that a young child usually increases in strength. They are longer, they are leaner. These are the times when they talk a lot already, right? Aside from counting, they'll ask you a lot of questions. Questions that sometimes you want to answer, sometimes you just want not to answer, right? So this is also the time when they already recognize their emotions. Why they're sad, why they're happy. And this is the time when friends becomes very important to them. Other than that, this is the time of exploration. You can just tell them, sit down in one corner in a garden. What will they do? They'll slowly go down, try to walk on the grass, try to manipulate the soil, and see for themselves what's going to happen. So this is your young child. So these are, with all those development and all those environmental insults that this young child encounters, these are the common skin affectation that this young child age group has. First off is eczema. Eczema that is usually resulting from very dry and sensitive skin, followed by, of course, your bacterial infection, your impetigo. Impetigo, also known as your mamaso, right? The folliculitis. These are the folliculitis is like a preamble to your boils, the common pigsa. Okay? And then the viral infection, of course, mommies of young child would know. The skin rash, the exanthem, the measles, the German measles, or the tigdas hangin, and the viral warts as well as the mollusco. Now let's go on to the next age group, the child. So we're done with the young child. The child is the 6 to 12 years old. So this is the time when these children than narrating or telling you stories, they would also use the figurative language, some metaphors. Also at this point in time, just this children prefers to play with people or gender, or same gender or same sex group of friends. This is also the time when they already know what's no for them and what's yes for them. So this age group, what skin diseases do we deal with? Again, eczema is still there. Eczema that's resulting from sensitive skin. And always remember, the 6 to 12, I think you will all agree with me, the varying hygienic practices, right? The boys, a bit harder to push to take a bath than the girls. The boys, it's harder for them to tell them, can you please shampoo your hair? Can you please put on your soap? Because the girls will do that because they know it's part of bathing. But for boys, you have to watch them in the skin of your children and minimizing exposure to the environment. But then again, if you cannot minimize the exposure to environment, well, at least protect the skin from this exposure. So, starting off with bathing and cleansing, a good hygienic practices means bathing and cleansing with mild soap. So every day, our children encounter thousands and thousands of environmental substances. These substances might look like harmless or benign, but in fact, we don't know its irritancy potential. That's why it's very important that when bathing a child, you should know how to choose a cleansing agent, right? You don't just choose it based on how many likes it got from Instagram or from Facebook. As a mom, what do we? Yeah, we Google up, of course. We read blogs, we look at Instagram, we look at Facebook, but everything has to be consolidated, right? So, one of the good characteristics of a good skin cleanser is it has to be neutrally charged to no charge at all. It should fall in this part of the category because if it's neutral, if it's zero charge, it will not attract ions. Remember your bacteria, your virus, and fungi, they are attracted by charges. Okay? So if your soap doesn't attract anything because it's zero, it's neutrally charged, it won't attract additional inciting agents or additional virus, fungi from the environment. And this also dictates the mildness. The more neutral or the more zero charge they are, the milder your soap is. Right? Next. A good cleanser should have the least amount of stabilizers and the least amount of preservatives. Alam nyo to, parabens. Alam nyo yan very well. Yan ang sinesearch nyo, ano ba ang parabens? Parabens are a group of chemical compounds that actually adds stability. It's like a preservative so that the shelf life of your products will be longer. That's why these organic products, they have less. They really don't use parabens. They have very less parabens. That's why their expiration date is lesser. Okay? No formaldehyde. Of course you know formaldehyde. It's formalin. And you know what formalin is for? It's to preserve, right? So you don't want a product with formaldehyde. And of course, you want a non-GMO produced cleanser. So again, if you're looking for a cleanser, you should make sure that your cleanser, as you are cleaning, it's already an emollient and a moisturizer at the same time. So this is a journal that is from a review on extensive skin benefits of mineral oil. This is by Rollins et al. This is a published and paid journal. Okay? So this compares mineral oil from vegetable oil. And what I want to highlight here is that the physical appearance of your mineral oil is very similar to that of your petrolatum because mineral oil is a derivative of your petrolatum, your petroleum jelly, if you're familiar, your Vaselina blancas. That's why it's colorless. It might have a little color, but it's due to the refining process. It is very good as a moisturizer and it's non-toxic. So, the efficacy of mineral oil in the skin as an emollient is this three. It is an emollient. When you say it's an emollient, it's a moisturizer. It's an occlusive. I'm going to explain this a little bit more. And it improves the skin surface. So let's see this one. Transepidermal water loss. When we say transepidermal water loss, it's the water that dissipates into the environment. Okay? Because your skin produces its own water. May water tayo sa skin. Hindi mo kailangan ng maraming moisturizer kasi may sarili kang moisture from your skin. Ang problem is, our humid environment, our temperate climate pulls out this water. That's what this transepidermal water loss is all about. So, if you're going to look at this, they compare several vegetable oil with petrolatum. The petrolatum is at the bottom most, this one. So when you look at after application, 30 minutes after application, you see the transepidermal water loss is 5.08. It's least, pinaka-konti yung transepidermal water loss na compared with the other vegetable oil. Jojoba, soybean, avocado, almond oil, and paraffin. Okay? So,
can I have the clicker? Oh, yeah. Okay, cool. I came earlier, so I was able to interact with some of the people earlier here. Can I have my PowerPoint, please? Okay, so basically I'm going to introduce you probably a new term for most of you here, and that is psychodermatology. Has any one of you been familiar with this term? Not so much. Okay, so we're going to talk a little about that because that is the framework that I'll be using for our lecture this morning. Is anybody familiar with EMDR, eye movement desensitization and reprocessing? Okay, it's another form of psychotherapy. Maybe in the open forum you could bring it up. So I have no conflict of interest. We'll talk a little about psychodermatology, and once you understand the scope of psychodermatology, you will now better appreciate the psychosocial dimensions of dry skin. So let's first focus on what psychodermatology is. It's like, okay, what is it? Is it psychology? Is it dermatology? What is it really all about? Well, it first started with the question, really, is there a relationship between mind and skin? And perhaps for you with any skin disease, by the way, does anybody of you have atopic dermatitis in the room? Oh, you have one, atopic dermatitis. Do you still have it up to now as an adult?
Yes.
Oh, how about your child?
She has when she was 3 months to 5 months.
But because you have it, you know how to deal with your child much better. So that's the gift I think it has. Anybody here with psoriasis? That's another chronic eczema. Okay, cool. So thank you for sharing that. So let's explore this. When we talk about the connection between mind and skin, we actually realize that indeed there is. And in this particular publication, the Harvard Medical School, they had called this field psychodermatology. What's interesting in the States, anybody, not necessarily a doctor or a clinical psychologist, with interest in dermatological conditions could also be in the field of psychodermatology. Moreover, let's try to break it down into a more understandable concept. First, you may have somebody with a psychiatric condition. Speaking of psychiatric conditions, what psychiatric condition goes at the top of your head that you know? Could you name me one? Psychiatric condition. What are you
Schizophrenia.
familiar with?
Schizophrenia.
Depression? Yes. Yes.
Schizo.
Schizophrenia? Okay, this is a rather sophisticated group. When somebody has depression, just let's talk about depression. Schizophrenia is, is another, but when somebody is depressed
Psychology.
and you add another chronic condition like diabetes, that depression impacts on the diabetes because if you're depressed, you don't feel like moving, you don't feel like, waking up, you don't feel like doing any of the regular medications you're taking. And therefore, it worsens the clinical course of whatever medical condition you are. So that is certainly understandable. Moreover, like as what you said with schizophrenia, that's pretty good. In schizophrenia, these are people out of touch with reality. And because of that, they may start neglecting their skin. As what was mentioned in the earlier lecture, cleanliness is also very important. Now, because of that, they are prone to fungal infections, to nail infections, and because of the primary, what started as a primary psychiatric condition may actually result in the developing to a skin condition. So that's one field, one aspect of psychodermatology. Pretty clear? Next, let's go about that if you already have a pre-existing skin condition, like maybe for instance skin asthma, they would tell you, or even psoriasis, they would tell you, you know what, when I am stressed, it flares up. All of a sudden I think I'm going to have rashes because I can see my skin reacting. The reason for this, because the immune system plays a very vital role when you're stressed. The immune system gets down, and as a result of that, may cause the flare. So first, you have a psychiatric condition, and because of that, it may impact negatively in the skin. And secondly, I want to emphasize stress is really one of the modern ills affecting our society now, and it does impact on our skin as well. And third would be, if you have a chronic skin condition, and on top of that you're stressed, you may be coping with it, but maybe as it proceeds on, you may then develop depression. You may develop clinical depression. I want also to explain to you, and since we're talking about terms, to also make it quite clear. Are you familiar with the mood scale? Okay. If I am here, this is normal mood, right? And if I, for instance, something bad happens to me, I will be depressed. Okay, is this normal or not? Not.
No,
What?
not.
Now,
No.
okay. So meaning to say, if something bad happens to you, you're not supposed to be depressed? Let me maybe put it again so you'll understand. This is normal mood. Something bad happens to me, I'm depressed. And if the intensity and duration gets extended, I may go to clinical depression. So now, if something bad happens to me, I'm depressed. Is that normal? Yes. Got it right. To a certain extent, yes. But you may be at risk to develop what? Clinical depression. And if you are clinically depressed, do you need to see a mental health professional? And then you may need maybe medication, psychotherapy. So that is pretty clear. So you have normal mood, depressed. Now that is just half of their normal mood, because there's also the other side of mood. Does anybody here know somebody full of energy, very energetic, I don't need sleep, I have so many ideas? What would you call that? Hyper? Okay.
Hyper.
Oh, got it. That would be mania. Of course, Wilsie got it. Again, that would be mania. I want to explain to you the terminology so you would understand, because you may have friends who may be experiencing this, and this gives you a handle on how to deal with it. Remember, this is normal, right? If we go on the other extreme, and yes, the term will be hyper, this person doesn't need sleep, always awake, talking excessively. And not only that, would gamble excessively, would shop excessively. Does that sound familiar? Okay. Buying designer bags excessively. I'm teasing. Okay. This will be manic. In this manic, I also have to remind you, this is a very distressing state because they don't have good judgment. I have seen patients go poor because their father went to a manic state and started engaging in risky business ventures, which all collapsed. So that is something you really, even as regular people, would understand. You must understand depression, clinical depression, but also understand the other side, which is mania, right? And what if I don't reach mania, a little less than mania? What do you call that? Lower than mania. That would be?
Borderline.
Borderline, close. It will be hypomania. And that is where these people would have increased level, but not to the extreme risk-taking behavior as with manic. Manic, really, certainly, they would need intervention for that. So you have to understand the gamut of it. And B, the patient may have depression or mania all of this may also impact with the skin. So you do understand the basic terminology for mood. I am in normal mood. What is this? Depression.
Clinical.
Clinical depression. Normal mood. What is this?
Mania.
Increased energy. This is
Hypomania.
hypomania. I go to the other extreme. Mania. Not hypermania. Mania is enough already. That's the highest thing already. So at least you know the terminology, and it's very important you know the basic concepts there. So I think I described this a little. We use the term chronic schizophrenia. Are you familiar with delusional parasitosis? When I actually did my psychodermatology observership in England, I was surprised. They had a lot of patients with delusional parasitosis. So what exactly is that? The patient comes to the doctor and says, "Doc, you know what? I think I have insects under my skin. I think there are worms there. I can feel them really crawling." Because we didn't see so much here. So I was asking my British dermatologist, what is the cause? You know what the cause is? Typically, people in England who complain of delusional parasitosis have a history of chronic marijuana use. That seems to be a risk factor for developing this. And remember, you know, the doctor is going to say, you know what, there's nothing wrong with you. Okay, you know what they do? They go to another doctor. They go to another doctor because they believe it's true. But there's no objective findings. So here, you already know about depression, you know about clinical depression, hypomania, mania, schizophrenia, a little about it, and now that's another term, delusional parasitosis, when the person feels they're like insects or worms, what they feel in their skin. Now, body dysmorphic, some of you are lifestyle bloggers. Does anybody here know what body dysmorphic is?
Body.
Okay. You do know there's a lot of interest now in cosmetic procedures, right?
Yeah.
It's nothing wrong if you say, you know what, I want to have my nose fixed. You know what, I have my 25th reunion, I want liposuction, I want to look good for my hair. You know what, I'm getting married, you know, I want to, you know, look good. There's nothing perfectly wrong with that. This, however, is a more extreme state when we talk about body dysmorphic. Doc, you know what? I want my nose fixed, but I want it 2 degrees slightly to the right and about 1 degree going up. I'm not kidding. They want it perfect. They don't, and there's such a thing. It will never be to how they want. So you know what happens? I go from one doctor, oh, you know what? It's still not good. I go to another doctor, I go to another doctor. And typically they have history of chronic doctor hopping. So once you see somebody who uses, you know, cosmetic procedures almost like a hobby, you begin to wonder, maybe there's something underneath that's propelling this, and it may be body dysmorphic. So you see now how a psychiatric condition by itself is stressing, but it can also impact on the skin and actually may result in a skin condition. Secondly here, this is quite understandable. You may have atopic dermatitis, you're stressed, and it becomes chronic stress, it may lead you to developing depression, which doesn't make it even easier. And lastly, stress. Atopic dermatitis, and thank you for sharing, by itself is very stressful. But you know what? You have to deal with other stresses as well outside from that. So they go back and forth as well. And typically when we think of this framework, it may range, the skin condition may be simply just dry skin, or even lead to eczema, which I think Dr. Wilsey really explained very well in her lecture earlier. So let's now segue into the psychodynamics, psychosocial dimension of dry skin. But what exactly is the difference between dry skin and eczema? I also want to explain to you, eczema is an umbrella term of chronic skin conditions. And let's hear now from this video from Chris Sack. Video please, audio. Audio, please. Oh. Audio. Okay. Okay. Sorry for the slide.
Skin. In medicine, we call this xerosis or steatosis. Well, what happens with dry skin? Why does it happen? Well, with loss of moisture and loss of the barrier oils in our skin, this leads to cracks in the skin at a microscopic level. So it's kind of like a dried riverbed. And over time, when your skin is dry and cracked, it will become very itchy, which leads to scratching, of course, and increased scale or flaky skin, which can then lead to eczema. Here you can see an illustration of how xerosis or dry skin over time is the pathway to eczema. So we start with dry skin as pictured, and then over time we itch our skin, which then leads to these, in this case, coin-shaped patches, what we call nummular eczema.
So it's very clear
Of the frustration and pain having children with very dry and sensitive skin. So now that we have Oilatum that addresses dry and sensitive skin, we hope that you will be able to share this information to your respective platforms. No? So thank you very much. And we at STADA, our mission is to take care of the health of all the Filipino people. And Oilatum is just one of the many products that we will be bringing in the Philippines. So this is just the start. This may be the closing, but this is the beginning of a nourishing relationship. So I will see all of you again in the next media event that we will be holding in the next few days, weeks. Thank you very much, and I think pwede pa rin kayong mag-dessert outside. So we will not take much of your time. Thank you.